talked about all the good things that happen from changes in your diet, especially when it comes to a cancer diagnosis. Any side effects, anything, are there any side effects of making these changes?
So I would say the only major thing to think about is, like I alluded to before, is that if a patient has too many other side effects from their treatment or is overwhelmed by everything, adding in nutrition without doing it gradually or at a time that they're receptive can increase the stress or feeling of guilt for a patient or add to what they need to do. And I don't think that is necessary. I think we need to find the right time when patient is more receptive, or when they're able to start tolerating the treatment after a few months of the treatment, when we start thinking about bringing in these changes. And we should make these changes, especially while they're on treatment, in a very gradual manner and slowly. And once they're able to tolerate it and they start finding the benefits from it, then you can move further in that direction. So I would say that would be the main thing, because sometimes when patients hear about dietary changes, they start thinking, okay, I won't eat this and that. And when they stop eating all those foods, they suddenly don't know what to add in because they're not used to it. And then they're just eating less calories. And then that's not a good situation to be in, because then they're losing weight. So you want to do it gradually, where if you're taking out the red meat, you're adding in the beans, and you start enjoying the beans and you know that you're going to eat them. And then you move on to making another swap that you do like. So making these stepwise gradual swaps are probably the best way to keep it sustainable, and also not have undue side effects of not eating.
Makes sense. Makes sense. Perfect. Is there anything else, Dr. Shah, that you'd like to mention, when it comes to nutrition cancer, that you'd like patients to know?
I think start slow and start gradually. Keep your mind open to it, and make just even small swaps can help in the long term. Sometimes it's hard to see when you do a small change and think that, okay, this is not going to make a difference because we're not seeing the immediate effects. But these are over a lifetime. And as cancer patients, and we're living much longer, we have much better therapies. It's these small changes that are going to help us live better quality of life in the long term.
Perfect. Perfect. Thank you, Dr. Shah, for really summarizing the evidence and the practice behind an additional tool that cancer patients have in their toolbox, in addition to, the rapid and radical advancements that we've seen in cancer treatment over the last 10, 20 years, that they can make small incremental changes, not only by, eating a more plant-based diet, but as you mentioned, by also increasing the fiber in their diet and by increasing the variety of foods that they're eating, to better their chance of an improved outcome with cancer today and also in the future.
Maybe I'll just add one more thing.
Please.
And so when we talk about plant-based diets, people often get confused thinking, what is a plant-based diet and what do we mean by that? And while we're talking about a plant-based diet or a whole food plant-based diet, we're not saying that everybody, to achieve the benefits of a plant-based diet, needs to go completely 100% vegan or even vegetarian. What we're talking about is trying to get the majority of the calories from unprocessed plant foods. So somebody could be doing a whole food plant-based diet in a Mediterranean sort of way, in a vegan sort of way, a vegetarian sort of way, or they could be even potentially doing it as a keto way if that's what works for them. But the majority of their calories are coming from unprocessed plant foods when we talk about a plant-based diet. And I like to say, like, about 80 to 90% of the calories are coming from that.
Makes sense. Makes sense. And actually, there is actually one other thing. If patients want, a resource that, what do you think is the best resource that patients can go to, if they want more information about these specific changes?
I do like the American Institute of Cancer Research website a lot. If there's one resource we had to pick, I would say that one, because they really have a whole section on foods to limit and foods that fight cancer. And with each food group, they talk about the different chemicals that may be having, anti-cancer properties. Like in broccoli, there's sulforaphanes and things like that. And then all the evidence around it. So papers that link to that food group, and then foods to limit. So that's one place, but they also have a lot of information for healthcare professionals, which the handouts can be given to patients, and also information for patients. So and then recipes as well. So they have ideas for cooking as well.